The whole second floor was engulfed in flames and smoke, so I couldn't see anything.
Raymond Payne's life was turned upside down by a fire last night at his family's home in Corryville. Firefighters had to rescue his mom and sister.
They're going to be all right. It's just they're in a hyperbaric chamber, and to get all the smoke out of their lungs. My mother got burns on her leg and on her back and on her side and on her hand.
That hyperbaric chamber, which pumps 100% oxygen to patients, is at a hospital in Columbus, not the Level 1 Trauma Center just minutes away.
UC used to have a hyperbaric chamber for acute care years ago, but a business decision was made back when the hospitals were united under the Health Alliance that Christ Hospital would house and staff a chamber for other hospitals to use. But when the Health Alliance dissolved a few years ago, that level of care disappeared from Cincinnati.
Those kinds of facilities are relatively rare. But having them at least within a good transportable time is a very, very important situation.
The former state fire marshal says there are only a handful of times a year when this type of care is needed. He thinks it would be nice if Cincinnati could still offer it, but it comes down to the cost.
That expense outweighs the ability, if that patient is viable, to be able to be stabilized at that trauma center and then moved on to a facility that's centrally located.
Sydney Benter, Local 12 News.